It is Thursday, May 7th. Welcome to our daily COVID-19 Task Force update. I'm Joe Delarone. Today on the program we'll have our Commissioner Lloyd Phillips make his daily presentation, and Don Montour-Lazare from the Kahnawake Memorial Hospital Centre will be joining us as well. Before we start, if you've been listening to the news on K1037 all day today, there was mention that the Elders Lodge would be open for visitors for Mother's Day and beyond. That is being scaled back. So listen tomorrow for further updates on that. We'll have a full update for tomorrow, but once again, it is not going to be fully opened like it had been mentioned earlier. So we'll get the program underway today with the manager of outpatient services from the Kahnawake Memorial Hospital Centre. She's been on this program before, so let's welcome back Don Montour-Lazare.
Sego. So I am coming to talk to you today about safety equipment and gloves and masks and how to properly use them to protect you. As I go around, I'm really happy that people are trying to take initiative to keep themselves safe and keep the community safe, but I want to make sure that people are doing it safely. So I want to talk about masks. So this is a mask that we use in the hospital. It's a medical mask. Mostly what we try to do is to encourage people to save them for the medical staff. I've seen a lot of people using cloth masks lately, which is good. Cloth masks are great because they help to prevent the spread. So if you're wearing the mask, it helps to prevent you, like if you're coughing, that the virus doesn't go all over the place. But the important thing with the mask, especially with the homemade mask, is that you have to remember that you can't continue wearing it forever and ever. It needs to be washed. So if you're going to have cloth masks, it's important that you have several of them, so that if you go into the store, you either keep it on and wait till you get home and take it off, and then dispose of it someplace where you can wash it right away. So my suggestion is to deposit it right directly into your washing machine. If you're using a mask like this, I'm going to use this mask to show you how to properly put it on and how to take it off, and the safety things that we expect with this. So if you're going to put it on, you put it on over your ears, and you open it up, and then there's a metal bar at the top. And if you notice that I use the dark purple part is on the outside. Most masks have some kind of color or some other design on the outside, and the inside is white. So the white side is the part that goes towards you, and the color part goes towards where everybody else can see. Now, you don't want to be touching your face. One of the things we keep telling people is to wash your hands. So after you put the mask on, you'd wash your hands before you put it on too, but once you put it on, you wash your hands again. Now, we tell people to wash your hands. We ask you not to touch your face. And just because you have the mask on doesn't mean you can touch your face, because as soon as you touch your mask, you've contaminated your hands again. So if for some reason you needed to readjust it and that, just remember that you have to go back and wash your hands again. You want to make sure that you wash really well, to make sure you get everything. And even if you're using hand sanitizer, you should be rubbing your hands very well and keep going until it's completely dry. One of the things too as well is if you have a mask, we don't want you to alter it in any way, so you shouldn't be cutting holes in it. I saw a video the other day where this woman cut a hole through it because she couldn't breathe through the mask. I've seen people pull the mask down to talk. As you can see right now, I'm talking very fine with the mask on. If you think about it, surgeons wear this on their face for 8-12 hours at a time while they're in surgery. They are not touching their face. They're talking during the whole time while they're doing their surgery, so it doesn't impede anything. It takes a little getting used to, and yes, there's a little bit of like fluff and things that might be irritating. So you try not to touch your face as much as possible. But again, if you do touch your face, go back, wash your hands again. The other thing is that if you have the mask, you wear it on or you take it off. So the things we don't want to see you doing, we don't want you doing this, walking around with it on. We don't want you walking around like this. So you want to make sure you keep it on your face. The other things, like I said, we don't want you to, don't alter it in any way. Don't touch your face. And when it's time to take it off, when you decide you're going to take it off, what you would want to do is be over the garbage pail. I'm just going to pretend there's a garbage pail down here, but you would lean over so that it won't fall on you. Or if you have your cloth mask and you're doing it over your washing machine, you want to be over the drum, and you grab it by the earpieces or the hair or the ties that you might have behind, and you deposit right into the garbage, and that's it. Wash your hands. To clean your cloth masks, you just need regular laundry detergent, and putting it on high heat is probably recommended as well too, but it's really the soap that actually breaks down the virus. The virus is got a lipid layer on it, a fatty layer on it, so the soap actually what disintegrates, the alcohol disintegrates the virus and makes it dead. The other thing that I see people doing is they're wearing gloves. They're wearing gloves everywhere. The gloves, we use them a lot in the hospital, as most people know. We put them on, and we usually use them when we're doing procedures that can be very dirty. So for cleaning wounds or anything that might have any bodily fluids. In this context, I'll tell you, I don't wear gloves, and I'll tell you why. Because the gloves kind of provide a little bit of a self-sense of security, so people think that once they're protecting themselves, that that they don't have to worry about it. You have to remember that this is a respiratory disease, so it goes into it's really here that you have to worry about. That's why we tell you not to touch your face. But when people have the gloves on, they think that they're invincible. So then they're touching their face, they're doing all kinds of things, they're readjusting their mask, and they have their gloves. So if you have gloves on, you're not going to think about washing your hands, because as I've told you, if you have a mask on, if you touch your mask, you should be washing your hands. But if you have gloves on, you're not going to do that. So this is one of the reasons why I don't like people wearing gloves on, because I've seen it in the stores, they're touching everything under the sun, they're touching their face, and they're actually more likely to contaminate themselves. And then they're wearing their mask and they're touching their mask. Now, one of the main reasons why you wear a mask is to protect others from you. If you have it, you don't want to spread the virus. That's one of the good reasons why the CDC is encouraging people to wear it. But you don't want, as soon as you start touching your mask and have your gloves on and you're touching everything, you're kind of spreading the virus around. So that's why one of the reasons why I say I don't like people using gloves. Gloves are great for cleaning toilets, washing dishes, doing that kind of thing, so your hand stays nice. They're good for medical staff to be doing procedures that we do. But if you notice, as soon as we're done the procedure, the gloves come off. They go in the garbage, not on the ground all over the place, in the garbage. And when we're done, again, we're washing our hands. Oh, so hang on a second. The other thing I wanted to show people how to do is to properly wash your hands. And I'm going to show you with gloves and some paint, because it's the most visual thing I can use to show you how to properly wash your hands. And this could be with soap, can be with hand sanitizer, either way. And of course I didn't open this. Oh, shoot. I didn't think to fix this. Sorry about that. Oh, never mind. Okay, so let's pretend I'm putting a little bit of hand sanitizer or soap in my hands. So what you want to do is to rub your hands together, so that you're spreading, and it's the friction as well too, as the soap that's gonna kill the virus. So you're doing that. Then you want to get the top of your hands and in between your fingers on both sides. And you'll see I haven't got everything, right? So you want to get the top of your fingers. So you'll be rubbing your fingers like this, and then you need to get your thumbs. And then you'll want to get the rest of your hands. So you'll be going like this, and your wrists. And then when you're done, your hands are all clean. This is the reason why we tell people to take 20 seconds to wash your hands. I mean, you saw it took quite a while, and you need to think about getting all the surfaces. So the palms, interlacing your fingers, both hands, getting your fingers, your fingertips, your thumbs, and then your wrists and your hands. And then you'll get it fully covered. It takes a lot of practice, and it gets easier with time. And by this point, I think everybody should be pretty much a champion in washing their hands. And the other thing that's important too is, especially as you're washing your hands a lot more, you're going to notice that your hands are starting to get a little bit raw, a little bit cracked. That happens to medical staff on a regular basis. We use hand lotion on our hands to make sure that we don't get cracks on our hands. We use any kind of lotion. We usually try and find something that doesn't have any petroleum base, anything Vaseline, not Vaseline based. Even the Vaseline intensive care actually doesn't have petroleum. You have to read the labels to make sure it doesn't have petroleum jelly in it. The reason why is because a lot of the hand sanitizers, a lot of the soaps will not be as effective if you have petroleum jelly in them. So you want to make sure that you have something that will protect your hands, but also won't work against the soap or the hand sanitizer that you're using to protect your hands. And I think that's it. The only other thing maybe I would like to talk, well, since I'm here, I'll take advantage of it. We've had a little bit of concern, and you've probably seen it on the news, is that patients are not seeking medical care as quickly as they should. So by the time they call an ambulance and that, they're actually really in a lot of danger, having strokes, major heart attacks, and waiting too long. And when we're having strokes or heart attacks, one of the things that's very important is we say that if you wait too long, there's more damage being done to the brain or the heart. We say time is muscle, time is brain. So what we want you to emphasize is that if you need any care, do not be afraid to call the ambulance. Do not be afraid to call the hospital. We do have appointments. Yes, most of them are being done by phone, but we do have people coming in to see the doctors. Our priority is to take care of our community and to make sure that people are safe and that their health is being taken care of. Yes, a lot of the hospitals have COVID. Yes, they have places that are restricted for COVID, but remember, they also have a lot of places in there that are reserved for people who don't have COVID. And right now, because there's not a lot of people going to the emergency rooms, and we encourage you not to go there for minor things, but you should go there. Like if you're having severe abdominal pain, if you're having chest pain, if you're having a really hard time to breathe, and remember, there could be other reasons why you're having a hard time to breathe, which could be related to your heart. We want to make sure that you get the care that you need. Don't wait too long, please, because it could be a matter of life and death. And this might have nothing to do with COVID. This is just regular health information. And we do have, there's clinics. Our clinic is still open. If somebody has a major cut in their hand, we still do repairs. We still see people with rashes. We've actually worked a way around it. So sometimes people will text pictures of their rashes, and so we're showing them to the physicians, and they're taking care of it. We're finding very new and novel ways to take care of people at home. So please don't be afraid to call. If you have any questions, the nurses or the doctors will call you back, leave a message, and we will call you back, and we will try and deal with whatever you have. But again, if you're having chest pain, severe abdominal pain, severe headaches, you may be having a stroke in that, please call the ambulance. Do not be afraid to call them. And if you need to call them, don't be a call. 450-632-6505. Now,
Go Don, and I have to say that is a very impressive visual display, because we talk about this all the time. We work in the communications field, and sometimes you can put a great speech together, but seeing it like that made it very clear, because I'll admit, I'm guilty. Sometimes it's like, yeah, I think I did a good job. 8-10 seconds, that's good enough, because you wash your hands so many times a day. I'm going to take my time from here on in a little bit more. I know we're all trying to do our best. Also, I just want to say that the programs that we've been doing here, I guess, are very effective, because what Don just said about calling in for emergencies, if we recall, probably about 6 weeks ago, when David Scott came in and talked about not making calls for frivolous things that maybe you don't need an ambulance for, because people do in regular times, normal times, put a lot of demands on the fire brigade and the people who work on the ambulance. So they took it to heart. And as we found out, some people who had serious problems were saying, well, I don't want to bother them because of all this COVID stuff. And so the message changed a little bit here. And again, if it's a serious issue, please call and take care of it. To those who are watching on this very first live broadcast, you may notice that we're not in sync. The voice is not coming out at the same time as our lips are moving. This will be fixed up, and those who watch this later, it'll be okay. We'll take care of that. All right, so it's time to bring on Lloyd Phillips. He's our Commissioner of Public Safety, and he has his daily update for you now on the COVID-19 Task Force Daily Update. Lloyd?
Thank you, Joe. Thank you, Don, for that great display and obviously some great messages you're giving to the community. I just washed my hands off camera just before I came on air. Today, really, there isn't too much in terms of updates, but other than the fact that as mentioned previously, that we have the Kahnawake Economic Revitalization Plan, which work has been going full steam all week long, and we're expecting to have that final report presented to the full task force tomorrow. So hopefully by tomorrow afternoon, we'll have much more updates to bring you regarding that. As you may have seen, or you will see on the news, actually the island of Montreal, their date has been pushed back again for the reopening of retail businesses, schools, and daycares. It was originally supposed to be on the 11th, then it went to the 18th, and now they're pushing it back to the 25th because they're seeing that the conditions on the island of Montreal are not ready to take that extra risk of opening up those businesses. So again, we're watching these things very carefully, and we understand, areas on the South Shore here have opened their doors effective on the 4th, and moving forward, more things are going to gradually be opening up around us. Obviously not in the city, but that's a different ball game. But it's good to also realize and keep in the back of our minds that what's happening, in Montreal, and we all know Montreal is just a stone throws away. So those are things that we have to be very vigilant about to ensure that we're protecting our community and obviously the most vulnerable population, as we always been saying. Because if you look at some of the numbers in terms of deaths for the past week and a half or so, they've been averaging about 100 deaths per day, and the majority of those vast majority of them are elders. So it's a horrible situation over there, and we have to keep that in the back of our minds moving forward. Because as things evolve, as we decide to open up things gradually in our community, as directives get modified over the next little while, we have to keep that in the back of our mind that what level of risk are we prepared to take in order to revitalize our community, to open up the businesses, to get people having more freedoms and so on. There has to be a clear balance that is there. And so that's what we've really been struggling with, to ensure that we find that proper balance, and how we keep things fair from a business perspective. How do we make sure that it's fair for all or most? There's no way of, I'll be honest with you, there's no way of saying be fair for everybody, but how are we fair for the most people involved in the business community, to moving forward and when we're looking at a plan. So we understand that people have been hearing about this plan for some time, and like I said, it's comprehensive and it takes time. Not from the business perspective. I understand that the other side, the people who are not involved in business, there's a level of frustration that's building, and wanting to know when things are going to change, when certain measures are going to be removed or modified or loosened. Again, all these things are not taken lightly. Believe me, we hear the calls, we see the emails, and whatever from people, being frustrated on what is taking place. And to be quite honest with you, at the task force level, there's a level of frustration as well, because we're trying to progress as fast as we can, and we feel that pressure, and we're living under the same conditions that you are as well. So we want to get this done, and we want to move forward. We want to open up our community. We want to loosen restrictions as quickly and as safely as we possibly can. And so those are some of the things that I want to relate to the community, that things are moving, things are being looked at, things are not stagnant, We have our medical advisors. Dr. Goche has been chiming in on various elements to ensure that that we are in line properly and taking the steps we need to remain safe. So with that, I really don't have too much more for the update other than to remind the community to stay safe and some things that like Don had just presented about washing hands. That's going to be the new normal. This 20 seconds of washing your hands and sanitizing and these things. That's gonna be something that we should put in our minds, and that's not something in the next few weeks or months that we're gonna forget about. It should become something as a new habit that we all get ourselves into. So with that, again, I'd like to thank Don for being here and I appreciate the information. So I'll see you tomorrow afternoon on Kahnawake.
All right, thank you very much, Lloyd. And I had an itchy nose there, now I gotta wash my hands again, and sorry about that. I apologize, but it's the way it goes. As we wrap up today's program, just wanted to mention a couple of things on the positive side, because as we live through these difficult days and weeks, and hopefully not turning into too many months, but there are some things that happen that are nice. For example, next Tuesday, there's going to be a little parade going around town to pay tribute to first responders. It's going to stop the peacekeepers, the fire brigade, and also at the Cattery Memorial Hospital Center. They were talking about that on K1037 this afternoon. So that's a very nice initiative. People smiling about that. We saw Moochie playing music outside the hospital last week, and people were dancing in the streets, literally. And I happened to go there for a moment and saw the patients just smiling and being very, very happy. Today there was something that the Royal Canadian Air Force has been doing for the past week. During this week, they started on Monday. They've been going across the country. They put it out there, and it's called Operation Inspiration. And they said if we wanted it here, they'd pass by Kahnawake. They did. A lot of people out watching. I was along the seaway, and so hopefully you got a good view of that. But again, these are just things to help put a little joy in our lives, because things are a little tough. Let's all admit that. With that, just a reminder for the health check. It's going very, very well from my understanding today. Well over half of the Kahnawake directory of people whose phone numbers are listed have been approached, and so the numbers are great. Once again, they're looking for people specifically. If you're not listed in the directory, you can call 638-3930, and there are 4 numbers that you can contact, 4 extensions: 2275, 2225, 2296, 2276. Those extensions will get you to talk to somebody who will then work on, they'll call you back and have the health check done. Doesn't take very long. If you need to be checked, then they'll arrange that with you. But the information is really helpful. It's going to help the entire community as we move forward. With that, I guess that's it for today. I know we've been very busy. We'd like to thank Dawn for her excellent presentation. I'd like to thank Lloyd once again for his update, and we'd like to thank you for joining us on this Thursday afternoon. We shall be back tomorrow at roughly the same time. So on behalf of all of us here at the Kahnawake COVID-19 Task Force, Nyao Koa Dano, Ona Iwahi.